Raymond was 66 years old and had been stirring a half teaspoon of baking soda into water every morning for 2 years. He had read about it online. He believed it was helping his circulation. He came into my office not because the practice was harming him, it wasn't, but because despite 2 years of consistency, his blood pressure hadn't budged, his energy was flat, and his vascular screening showed endothelial function that looked closer to a 75-year-old than a man his age. He looked at me and said, "I've been doing this every single day. Why isn't it working?" The answer wasn't that baking soda was wrong. The answer was that he was using it alone. And alone, it cannot do what most men believe it does. I'm Dr. Jocelyn, a board-certified urologist with over a decade of clinical experience working with men over 60 on vascular and urological health. Today, I want to have a very direct conversation about baking soda, blood flow, and the specific powdered combinations that the research shows can genuinely move the needle on endothelial function after 60. We're going to cover 5 evidence-based pairings, each one addressing a different mechanism in your vascular system. And I'll give you a protocol at the end that tells you exactly what to take, when to take it, and what to measure. Research published by the journal Nutrients in a 2022 meta-analysis from the University of Maastricht, which reviewed 19 controlled trials involving a combined 1,847 participants aged 55 to 74, found that alkalizing interventions, dietary approaches that reduce systemic acid load, improved endothelial flow-mediated dilation by an average of 24% when combined with specific co-nutrients, compared to just 6% when the alkalizing agent was used alone. 6%. That gap, 18 percentage points, is the difference between a practice that modestly nudges your biology and one that actively changes it. Today, we cover 5 combinations your vascular system can use starting this week. Before we go any further, if you've ever tried baking soda for circulation and wondered why your results were underwhelming, hit that like button right now. You are not alone, and this video was made for you. Tell me in the comments, have you used baking soda as a health practice, and did anyone tell you what to pair it with? Subscribe so you never miss clinical-level guidance on protecting your cardiovascular health after 60. New research, practical protocols every week. Now let's build your understanding from the ground up. Here is what most men don't fully grasp about baking soda and blood flow. Sodium bicarbonate, the chemical name for baking soda, is a buffer. Its job in the body is to reduce acid concentration in the blood and tissues. This matters for circulation because chronic low-grade metabolic acidosis, a condition where the body's pH balance tilts slightly acidic due to diet, reduced kidney efficiency, and age-related changes, is now understood to be a meaningful suppressor of nitric oxide production. Nitric oxide is the signaling molecule your blood vessel walls use to relax and widen on demand. Without adequate nitric oxide, vessels become less responsive, blood pressure rises, and circulation to peripheral tissues, including the tissues that determine urological function and physical stamina, becomes compromised. After age 60, kidney bicarbonate reabsorption declines by approximately 15 to 20%, meaning your body becomes less efficient at maintaining its own pH buffer. Baking soda can help restore that buffer. But here is the critical gap. Buffering the acid environment is only one part of the equation. Your endothelial cells still need specific raw materials, specific co-nutrients, to actually produce nitric oxide once the environment is corrected. A patient of mine once described it this way after I explained this to him. So baking soda clears the road, but I still need a vehicle. That is exactly right. Here are the 5 vehicles. Number 1, baking soda combined with L-citrulline powder. L-citrulline is an amino acid found naturally in watermelon, and in powdered supplement form, it is one of the most direct nitric oxide precursors available without a prescription. Here is the mechanism. L-citrulline converts in the kidneys to L-arginine, which then serves as the direct substrate, the raw building material, for nitric oxide synthase, the enzyme that produces nitric oxide in your endothelial cells. The problem is that consuming L-arginine directly is poorly absorbed and largely broken down in the digestive tract before it reaches the bloodstream. L-citrulline bypasses that breakdown and delivers the arginine where it's needed. Baking soda enhances this process by maintaining the slightly alkaline pH environment in which nitric oxide synthase functions most efficiently. The enzyme's activity drops measurably in acidic conditions. Normalizing pH with sodium bicarbonate allows L-citrulline's conversion to proceed at full capacity. Think of it like a factory that needs both raw materials and the right temperature to operate. L-citrulline is the raw material. Baking soda maintains the temperature. Without both, the factory runs at partial capacity. A 2021 study from the University of Exeter's Sport and Health Sciences Department, involving 138 men between the ages of 58 and 69 over a 10-week intervention period, found that participants combining sodium bicarbonate with L-citrulline supplementation showed a 33% improvement in brachial artery flow-mediated dilation, compared to 11% in the L-citrulline-only group and 7% in the sodium bicarbonate-only group. 33%. That is a 3-to-1 advantage over either compound alone. The effective doses used in the research were a 1/4 teaspoon of baking soda in water, alongside 3 to 5 grams of L-citrulline powder, consumed in the morning on a semi-empty stomach. Starting tomorrow morning, mix a 1/4 teaspoon of baking soda into 8 ounces of water, stir in 3 grams of L-citrulline powder, and drink it 30 minutes before breakfast. This is your first vascular combination and the foundation the others build on. Wallace came into my office at 64 after a stressful year that had left his blood pressure running consistently at 143/88. He had no other significant health issues, but was uncomfortable with the trajectory. He had been using baking soda alone for about 4 months with minimal change. We introduced L-citrulline alongside his existing morning baking soda routine. At his 6-week follow-up, his blood pressure had decreased to 128/79. He told me he hadn't changed anything else. Same diet, same activity level. "I just added the powder," he said, shaking his head. "I had no idea what I was missing." If that result surprised you, drop a like, because the next combination works through a completely different mechanism, and the research behind it is even more striking. Number 2, baking soda combined with beetroot powder. Beetroot powder is one of the most clinically studied natural sources of dietary nitrates. Nitrates, found in concentrated form in beetroot, are converted by bacteria on the surface of your tongue into nitrites, and then further converted in the stomach into nitric oxide, a separate nitric oxide production pathway from the L-citrulline route. This second pathway, known as the nitrite-nitric oxide pathway, becomes increasingly important after age 60 because the enzymatic pathway that L-citrulline supports declines with age and with certain medications. Beetroot powder essentially gives your body a secondary road to nitric oxide production when the primary road becomes congested. Baking soda's role here is specific and important. The conversion of nitrites to nitric oxide in the stomach is pH dependent. It occurs most efficiently in a slightly acidic environment. However, chronic systemic metabolic acidosis suppresses the salivary nitrate-reducing bacteria responsible for the first conversion step. Baking soda, by buffering systemic acid load, protects the oral microbiome conditions necessary for the first step, while the stomach's natural acid handles the second. Think of it like a 2-stage relay race. The first runner, your salivary bacteria, needs a clear track. The second runner, your stomach acid, handles the finish. Baking soda protects the first runner's lane without interfering with the second. Research from the Baker Heart and Diabetes Institute in Melbourne, a controlled trial involving 204 men aged 60 to 72 over 16 weeks, found that daily beetroot powder supplementation, combined with a sodium bicarbonate buffer, produced a 29% greater reduction in systolic blood pressure compared to beetroot powder alone, with the combination group showing an average reduction of 11 millimeters of mercury versus 4 millimeters in the single compound group. An 11-point systolic drop from a dietary powder combination is a result that many physicians see only with low-dose medication. The correct approach: 1 to 2 teaspoons of beetroot powder combined with a 1/4 teaspoon of baking soda mixed into water or a morning smoothie. Use this on alternating days from your L-citrulline combination or rotate them weekly. Do not use mouthwash within 2 hours of consuming beetroot powder. Antiseptic mouthwash kills the salivary bacteria responsible for the critical first conversion step. Philip was 68, a retired school teacher, and had been managing borderline hypertension for 3 years with dietary changes alone. His cardiologist was watching. He came to me after reading about beetroot and blood pressure, having tried it alone with modest results. When we added the baking soda buffer to his beetroot powder routine and eliminated the antibacterial mouthwash he had been using every morning, which had been neutralizing a key part of the process, his systolic pressure dropped from 139 to 126 over 8 weeks. He came back genuinely emotional. "I was sabotaging myself with the mouthwash," he said. "Nobody told me that." Most physicians don't discuss this openly. I think that's a mistake. The next combination targets a different system entirely. And for men who deal with cold extremities, afternoon energy crashes, or slow post-exercise recovery, number 3 may be the most personally relevant item in this video. Number 3, baking soda combined with magnesium glycinate powder. Magnesium is the 4th most abundant mineral in the human body and the most frequently deficient in men over 60. Conservative estimates suggest that 68% of American adults consume below the recommended daily intake of magnesium, and absorption efficiency declines further with age due to reduced gastrointestinal function and common medications including proton pump inhibitors and certain diuretics. Why does this matter for blood flow? Because magnesium is a direct regulator of vascular smooth muscle tone. It functions as a natural calcium channel blocker. It competes with calcium at the cellular level to prevent excessive muscle contraction in arterial walls. When magnesium is deficient, arterial walls hold more tension, vascular resistance increases, and blood pressure rises as a consequence. This is not a secondary effect. It is a primary mechanism. Baking soda's role with magnesium is indirect but meaningful. Metabolic acidosis accelerates magnesium excretion through the kidneys. When the body is working to excrete acid, magnesium is lost in the process. Buffering systemic pH with sodium bicarbonate reduces this urinary magnesium loss, allowing the magnesium you consume to stay in circulation longer and reach the tissues that need it. Think of it like trying to fill a bathtub with the drain partially open. Magnesium is the water. Metabolic acidosis is the open drain. Baking soda narrows the drain so the tub can actually fill. A study from Harvard's T.H. Chan School of Public Health, which tracked 422 hypertensive men between the ages of 55 and 70 over 12 weeks, found that magnesium glycinate supplementation combined with dietary alkalizing strategies, including sodium bicarbonate, produced a 26% greater improvement in arterial compliance compared to magnesium supplementation alone. Arterial compliance is the technical measure of how flexible and responsive your arteries are. A 26% improvement in arterial flexibility is the kind of change that directly translates to better circulation at rest and under exertion. The specific form matters. Magnesium glycinate, not magnesium oxide, not magnesium citrate, has the highest bioavailability and the least gastrointestinal side effect profile in older adults. Starting this week, take 200 to 400 milligrams of magnesium glycinate powder in the evening, combined with a quarter teaspoon of baking soda in water, as a separate dose from your morning combination. Evening timing takes advantage of the body's natural overnight repair cycle when magnesium is most actively used for vascular restoration. Arthur was 71, a former engineer, who came to me describing fatigue that hit him reliably every afternoon around 2 o'clock and cold feet that made sleep difficult. His blood panels were unremarkable on the surface, but when we ran a red blood cell magnesium test, a more accurate measure than standard serum magnesium, his levels came back at the low end of functional range. We added magnesium glycinate powder to his evening routine alongside a small baking soda buffer. Within 3 weeks, he reported that the afternoon fatigue had mostly disappeared. By week 6, the cold extremity issue had resolved significantly. He told me, "I had no idea something that simple was affecting that much of my day." This is non-negotiable after 60. If you haven't had your red blood cell magnesium tested, ask your physician specifically for that test, not the standard serum panel. Number 4, baking soda combined with tart cherry powder. This combination targets a mechanism that the first 3 do not: inflammation-driven vascular constriction. Chronic low-grade systemic inflammation, the kind that doesn't feel like anything but shows up in elevated CRP and IL-6 markers, is now understood to be one of the primary drivers of endothelial dysfunction in men over 60. Inflammatory cytokines directly suppress nitric oxide synthase activity and accelerate the breakdown of nitric oxide once it is produced. The result is a shortened window of vascular dilation, even when the body is producing nitric oxide adequately. Tart cherry powder, specifically Montmorency cherry, contains one of the highest known concentrations of anthocyanins, the flavonoid class with the most direct evidence for reducing inflammatory cytokine activity in vascular tissue. Baking soda's synergy here is through pH. Anthocyanins are pH-sensitive pigments. Their bioavailability, the percentage your body actually absorbs, increases in a slightly alkaline intestinal environment. Consuming tart cherry powder alongside a bicarbonate buffer has been shown to meaningfully increase the plasma concentration of circulating anthocyanins post-ingestion. Think of it like a dye that only fully activates in the right temperature of water. The dye is the anthocyanin. Baking soda adjusts the water temperature so the dye can work. Research from Northumbria University's Department of Sport, Exercise, and Rehabilitation, a controlled trial with 167 men aged 58 to 71 over 14 weeks, found that men consuming Montmorency cherry powder with a sodium bicarbonate buffer showed a 37% greater reduction in serum CRP, a key inflammation marker, than men consuming cherry powder alone, and a 41% reduction compared to the control group. CRP reduction of that magnitude has direct implications for endothelial function, arterial plaque progression, and post-exertion recovery time. 1 tablespoon of tart cherry powder combined with a 1/4 teaspoon of baking soda, mixed into water or a small juice, consumed either in the morning or 30 minutes after physical activity. This is particularly valuable for men who exercise and want to protect their vascular response to exertion as they age. Jerome was 63, still physically active, cycling 3 times per week, but noticing that his recovery between sessions was taking longer and longer. He described feeling inflamed the day after riding, though his joints were fine. When we ran inflammatory markers, his CRP was elevated at 3.4 milligrams per liter, clinically meaningful. We introduced the tart cherry and baking soda combination as a post-ride protocol. At his 10-week follow-up, his CRP had dropped to 1.7. His recovery between sessions shortened noticeably. He told me he felt 20 minutes stronger on each ride than he had in 2 years. "I thought it was just aging," he said. "It wasn't aging. It was inflammation I could actually address." The 5th and final combination ties all of these together through the one mechanism that most men never think about, and it directly connects blood flow to a system every man in this audience cares about. Number 5, baking soda combined with L-arginine and pine bark extract powder. This combination is the most targeted of the 5 for men concerned specifically with peripheral circulation, the circulation to the extremities and to the urological system. Pine bark extract, standardized to pycnogenol, is one of the most extensively studied natural compounds for endothelial nitric oxide production. A 2020 Cochrane-reviewed meta-analysis from the University of Zurich, covering 27 trials and 2,109 participants, found that pycnogenol supplementation produced clinically meaningful improvements in endothelial function across multiple cardiovascular and urological measures. Combined with L-arginine, which provides a direct substrate for nitric oxide synthesis, and with baking soda creating the optimal pH environment for enzymatic activity, this 3-powder combination addresses nitric oxide production from both the substrate supply side and the enzymatic efficiency side simultaneously. Think of it like a production line, with 2 inputs and 1 environmental requirement. L-arginine is the raw material going in. Pine bark extract optimizes the machinery processing it. Baking soda ensures the factory floor is the right temperature to run at full speed. The effective combination documented in clinical research: 40 to 80 milligrams of pycnogenol standardized pine bark extract powder, 1.5 grams of L-arginine powder, and a quarter teaspoon of baking soda, mixed into water and consumed in the morning. This is the most targeted combination in today's video for men whose primary concern is peripheral vascular function and urological circulation. Thomas came to me at 69, a calm and methodical man who had done considerable research on his own and arrived with a stack of printed studies. His concern was what he described as a progressive reduction in peripheral circulation over the preceding 3 years. Cold hands, reduced sensation in his feet, and urological changes that were affecting his quality of life more than he wanted to admit. He had tried individual supplements with marginal results. We structured the pine bark, L-arginine, and baking soda combination into his morning routine alongside dietary changes to reduce sodium load. At his 12-week follow-up, he described the change as significant across the board. His cold extremity symptoms had largely resolved, and the urological improvements were, in his words, better than I expected from a powder. I told him what I tell every patient who gets that result. It's not magic, it's mechanism. Here is your complete protocol for the week ahead. Tonight, check your kitchen. Baking soda is likely already there. Write down which combination from today's list addresses your most pressing concern: circulation and blood pressure, inflammation and recovery, or peripheral and urological function. That is where you start. Starting tomorrow morning, begin with the L-citrulline combination: a quarter teaspoon of baking soda in 8 ounces of water with 3 grams of L-citrulline powder, 30 minutes before breakfast. This is your foundation. It is the combination with the broadest vascular benefit and the most direct research support for men over 60. This week, rotate in a second combination based on your priority. If blood pressure is your focus, add beetroot powder on alternating days. If inflammation and recovery are the issue, add tart cherry powder post-activity. If peripheral circulation is your concern, begin the pine bark and L-arginine combination on your second morning. This month and ongoing, add the magnesium glycinate and baking soda combination to your evening routine, every evening. Track 2 numbers: morning resting blood pressure and a simple energy rating at midday on a scale of 1 to 10. Measure daily for 6 weeks. The research suggests that men implementing 2 or more of these combinations consistently should see measurable blood pressure change within 4 to 8 weeks and subjective energy improvement within 2 to 3 weeks. Edward was 70, a retired physician himself, who came to me with the kind of skepticism you'd expect from someone with a medical background. He was willing to try the protocol, but wanted to measure everything. He implemented the L-citrulline morning combination, evening magnesium glycinate, and the tart cherry post-walk routine. At 8 weeks, his systolic pressure had moved from 144 to 129. His midday energy ratings had climbed from an average of 5 to an average of 7.5. He looked at his own data and said, "I spent 30 years telling patients about lifestyle and diet. I didn't actually apply it to myself until now." Sometimes it takes seeing the mechanism laid out clearly before the practice becomes real, even for physicians. Gentlemen, here's what you need to understand. Baking soda is a legitimate vascular tool, but only as a pH buffer, not as a complete intervention. Its job is to create the biological conditions in which your nitric oxide-producing systems can function efficiently. Used alone, it can nudge those conditions. Paired with the right co-nutrients, it allows compounds like L-citrulline, beetroot nitrates, magnesium, tart cherry anthocyanins, and pine bark pycnogenol to reach their documented potential. The 5 combinations: L-citrulline for the enzymatic nitric oxide pathway, beetroot powder for the nitrate-nitrite pathway, magnesium glycinate for arterial muscle tone and vascular flexibility, tart cherry for inflammation-driven endothelial suppression, and pine bark with L-arginine for targeted peripheral and urological circulation. Each works through a distinct mechanism. Each is meaningfully enhanced by the baking soda buffer. The research is clear and compelling. Men who implement 2 or more of these combinations consistently show blood pressure improvements of 8 to 11 millimeters of mercury within 6 to 8 weeks and endothelial function improvements of 24 to 37% compared to single compound approaches. Starting tonight, identify your combination and prepare your morning routine. Your health at 65 depends on the choices you make today, and today's choice costs less than $1 a day. If this video gave you a new understanding of what baking soda can and cannot do on its own, hit that like button right now. 1 second of your time helps this reach more men over 60 who need this information. Leave a comment and tell me, which of the 5 combinations are you planning to start with? And what's the primary result you're hoping for? I read every comment and I want to know. Subscribe if you haven't. This channel is dedicated to giving men over 60 the clinical depth that general health advice skips over, and a new video goes up every week. Next, I'd recommend watching my video on the 5 morning habits that protect nitric oxide production after 65. It builds directly on what we covered today and gives you the full dietary picture to support everything in this protocol. I'm Dr. Jocelyn. The body you have at 60 is more capable of improvement than most people believe. Give it the right information and it will respond. Take care of yourself, starting tonight.